Dementia, it's a word that carries a heavy weight, often shrouded in fear and misunderstanding. But what exactly is dementia? It's not a single disease, but rather a collection of symptoms that result from damage to the brain. These symptoms affect cognitive abilities, impacting memory, thinking, behavior, and the ability to perform everyday activities. Alzheimer's disease is the most common cause, but other types include vascular dementia, Lewy body dementia, and frontotemporal dementia. While there's currently no cure for most forms of dementia, early detection is absolutely crucial. Recognizing the signs early allows for timely intervention, which can significantly improve the quality of life for both the individual and their loved ones. Early diagnosis opens the door to managing symptoms, accessing support services, and making informed decisions about future care and planning. This is why understanding the early warning signs is so vital. Now that we understand the importance of early detection, let's delve into the first key sign. Memory loss that disrupts daily life. Everyone forgets things occasionally, misplacing keys, forgetting a name, or missing an appointment. This is normal forgetfulness. However, dementia-related memory loss is different. It's persistent, progressive, and interferes with the ability to function independently. This type of memory loss goes beyond simply forgetting where you put your glasses. It involves forgetting important dates or events repeatedly, asking the same questions, and relying heavily on memory aids like notes or family members for things they use to handle easily. Individuals may struggle to remember recently learned information, have difficulty recalling entire conversations, or even forget the names of close family members. This persistent and disruptive memory impairment is a significant warning sign that warrants further investigation. Beyond memory loss, another early sign of dementia is experiencing challenges in planning or problem-solving, specifically difficulty with familiar tasks. This isn't just struggling with a new software program or a complicated recipe. It's about a noticeable decline in the ability to manage tasks that were once routine and effortless. For example, someone who always balanced their checkbook with ease might suddenly struggle to do so, making errors or finding it impossible to reconcile their accounts. Cooking a familiar meal could become overwhelming, with steps forgotten or ingredients misused. Following a simple set of directions, even to a well-known location, might present an insurmountable obstacle. These difficulties indicate a decline in executive function, the brain's ability to organize, plan, and execute tasks, and should be carefully observed. Another concerning early sign is confusion with time or place, often leading to disorientation and, in some cases, wandering. This goes beyond simply forgetting the day of the week. It involves a fundamental difficulty in understanding the passage of time, the current date, or even the present year. Individuals might believe they are living in a different time period or confuse past events with the present. Similarly, they may become disoriented in familiar surroundings, forgetting where they are, how they got there, or how to return home. This disorientation can lead to wandering, as they attempt to find their way back to a perceived, safe place, or a time they remember. These episodes of confusion and disorientation are particularly worrisome and require prompt medical attention. Beyond disorientation, dementia can also manifest as trouble understanding visual images and spatial relationships. This isn't just about needing glasses. It's about the brain's ability to process what the eyes see. Individuals might have difficulty judging distances, determining colors, or recognizing objects. This can have a significant impact on everyday activities, particularly driving and navigation. Judging the distance to other cars, merging safely onto a highway, or even parking the car can become increasingly challenging and dangerous. Similarly, navigating familiar routes, reading maps, or following directions can become confusing and overwhelming. These visual and spatial difficulties can significantly impair independence and increase the risk of accidents, making it crucial to address them promptly. Communication is fundamental to our interactions, and difficulties with language can be a significant indicator of cognitive decline. Problems with words, specifically difficulty speaking or writing coherently, are another key early sign of dementia. This isn't just about occasionally struggling to find the right word. It's a persistent pattern of language impairment. Individuals may struggle to follow or participate in conversations, frequently pausing to search for words or using incorrect terms. They might repeat themselves, have difficulty naming familiar objects, or struggle to understand what others are saying. Writing can also be affected, with sentences becoming disjointed, grammar deteriorating, or handwriting becoming illegible. These language difficulties can lead to frustration, social isolation, and a decreased ability to express needs and desires. Everyone misplaces things from time to time. However, the pattern of misplacing things combined with a loss of the ability to retrace steps is another sign that goes beyond simple carelessness and could indicate early dementia. This involves more than just losing your keys. Individuals may put things in unusual places, like placing their wallet in the freezer or their glasses in the sugar bowl. More significantly, they are unable to retrace their steps to find the misplaced item because they don't remember where they've been or what they were doing. This difficulty in retracing steps points to a breakdown in both memory and spatial reasoning, making it a more concerning sign than occasional absent-mindedness. Decision-making is a complex cognitive process, and a decline in judgment can be a subtle but significant early sign of dementia. This often manifests as decreased or poor judgment, particularly in financial matters, leading to unusual financial decisions. Someone who was previously financially responsible might suddenly fall prey to scams, give away large sums of money, or make impulsive and unwise purchases. They may have difficulty understanding contracts or managing their finances, leading to missed payments or mounting debt. These poor financial decisions stem from an impaired ability to assess risk, understand consequences, and make rational choices, highlighting a concerning decline in cognitive function. Beyond the cognitive and practical challenges, dementia can also impact an individual's social life and hobbies. A noticeable withdrawal from social activities and a loss of interest in hobbies can be an early warning sign. This isn't just about occasionally preferring to stay home. It's a persistent and significant decline in engagement. Individuals may start to avoid social gatherings, stop participating in clubs or organizations they once enjoyed, and lose interest in hobbies they were previously passionate about. This withdrawal can stem from a variety of factors, including difficulty following conversations, feeling embarrassed about memory lapses, or simply lacking the motivation to engage in activities. The loss of social connection and engagement can further exacerbate cognitive decline and negatively impact overall well-being. Finally, changes in mood and personality can also be subtle but important indicators of early dementia. This can manifest as increased irritability, suspicion, or apathy. While everyone experiences mood swings, these changes are persistent and represent a departure from the individual's typical personality that a normally cheerful person might become easily agitated or prone to outbursts. They might develop unwarranted suspicions about others, accusing family members of theft or infidelity. Alternatively, they might become apathetic, showing a lack of interest or emotion in things they once cared about. These personality shifts are often distressing for both the individual and their loved ones and should be taken seriously. Having reviewed the key warning signs, it's crucial to differentiate between normal age-related changes and those indicative of dementia. Recognizing the difference can be challenging, but setting a baseline understanding of an individual's cognitive abilities is a good starting point. Age-related changes might include occasionally misplacing keys or forgetting a name but remembering it later. Dementia, however, involves more persistent and disruptive issues, such as difficulty recalling recent events, struggling with familiar tasks, or experiencing significant personality changes. Think of it as a subtle shift versus a sharp decline. Observing these changes over time and comparing them to their previous abilities is key to distinguishing between normal aging and potential dementia. If you observe several of these warning signs in yourself or a loved one, it's crucial to consult a doctor. The importance of seeking professional evaluation cannot be overstated. While it can be frightening to confront the possibility of dementia, early diagnosis is essential for accessing appropriate care and support. A doctor can conduct a thorough assessment, rule out other potential causes of the symptoms, and determine if further testing is needed. They can also provide valuable information about dementia, treatment options, and resources available to help manage the condition. Don't delay seeking medical advice out of fear or denial. Early intervention can make a significant difference in the long run. So, what can you expect during a dementia assessment? Understanding the diagnostic tests and procedures can help alleviate anxiety. The assessment typically involves a combination of approaches. First, the doctor will review the patient's medical history and conduct a physical exam. Then, cognitive and neurological tests are performed to assess memory, language skills, attention span, and problem-solving abilities. These might include simple questionnaires or more in-depth neuropsychological evaluations. Brain imaging techniques, such as MRI or CT scans, may be used to rule out other conditions and identify any structural changes in the brain. Blood tests are also common to check for vitamin deficiencies or other medical issues that could be contributing to cognitive decline. Following a diagnosis, it's important to understand the available treatment options and management strategies. While there's currently no cure for most types of dementia, there are ways to manage symptoms and improve quality of life. Medications, such as cholinesterase inhibitors and memantine, can help improve cognitive function and memory in some individuals, particularly those with Alzheimer's disease. Therapies, including cognitive behavioral therapy, CBT, and occupational therapy, can help manage behavioral symptoms, improve daily living skills, and enhance overall well-being. The specific approach will depend on the type of dementia, the severity of symptoms, and the individual's needs and preferences. Beyond medical treatments, lifestyle adjustments and robust support systems play a critical role in managing dementia. Creating a safe and supportive environment is paramount. This involves modifying the home to minimize hazards, such as removing tripping hazards, installing grab bars in bathrooms, and ensuring adequate lighting. Establishing routines and using memory aids, like calendars and reminder notes, can help individuals maintain independence and reduce confusion. Engaging in stimulating activities, such as puzzles, music, or gentle exercise, can also help preserve cognitive function and improve mood. Furthermore, connecting with support groups and building a strong network of family, friends, and caregivers can provide emotional support and practical assistance. The role of caregivers is absolutely essential in supporting individuals with dementia. However, caregiving can be incredibly demanding, both physically and emotionally. Understanding the challenges and seeking support are crucial for caregivers to maintain their own well-being. Caregivers often face sleep deprivation, emotional distress, and financial strain. It's important for caregivers to recognize their own limits, prioritize self-care, and seek help when needed. This can include joining support groups, utilizing respite care services, or seeking professional counseling. Remember, taking care of yourself is not selfish. It's necessary to provide the best possible care for your loved one as dementia progresses. It's essential to address legal and financial planning to ensure the individual's wishes are respected and their assets are protected. Preparing for the future involves several key steps. This includes creating or updating a will, establishing a power of attorney to designate someone to make financial and legal decisions, and preparing advance directives, such as a living will, to outline healthcare preferences. Discussing long-term care options and exploring financial resources, like insurance and government benefits, is also crucial. Consulting with an attorney and a financial advisor can provide valuable guidance in navigating these complex matters and ensuring a secure future. Despite the current challenges, there is reason for hope. Ongoing research and future directions hold the promise of improved treatments and even potential prevention strategies for dementia. Scientists are actively exploring new medications, therapies, and lifestyle interventions to slow the progression of the disease and improve cognitive function. Research is also focused on identifying risk factors for dementia and developing strategies to reduce the risk, such as promoting healthy lifestyles, managing cardiovascular health, and addressing genetic predispositions. Clinical trials are constantly underway, offering opportunities for individuals to participate in cutting-edge research and contribute to the advancement of knowledge. It's also important to address and debunk common myths about dementia. Separating fact from fiction. One common misconception is that dementia is a normal part of aging. While the risk of dementia increases with age, it is not an inevitable consequence of growing older. Another myth is that there is nothing that can be done to help someone with dementia. In reality, early diagnosis and appropriate management strategies can significantly improve quality of life. Similarly, the belief that dementia is solely a memory problem is false. It affects a wide range of cognitive and behavioral functions. Understanding the truth about dementia can help reduce stigma and promote better care and support. In conclusion, understanding the early signs of dementia is a powerful tool. It empowers you to take action, seek timely medical evaluation, and provide informed support to loved ones. Early detection, combined with appropriate care and support, can significantly improve the quality of life for individuals living with dementia and their families. Don't hesitate to have difficult conversations. Advocate for those who may be struggling, and educate yourself and others about this complex condition. By working together, we can create a more compassionate and understanding society for those affected by dementia. Remember, you are not alone, and resources are available to help you navigate this challenging journey.